Edge Benefits podcast with the host, Tom Quigley. Tom, how are you? And, we continue to go down this, talking about cutting edge benefits and what you're able to do, Tom. I can't believe it. I'm sounding like Alan Porter now. Is this really true what you can do? And I keep telling people that there's nothing better than that. And I have a specific client that says he doesn't know if you can beat his price. And I said, I guarantee he can.
Yeah, it's taking candy from a kid at, Halloween. It's not too difficult, but the problem is it's common sense. So what people are doing is they're giving away thousands of dollars that could be in their account and only use it if they use healthcare benefits. You need the catastrophic because you got to get rid of the huge risks. If you have $1 million claim, you have a premature baby, you have whatever the story is, you got to have that covered. But all this other stuff, and you get a physical on all the plans too, so that's not a risk. So a year. So all this other stuff people are buying, I just look and go, well, what are you doing? Why are you doing that? Literally, you could fill the gaps. Like individuals should be buying, you can buy critical illness, accident, dental, hospital indemnity, buy a bronze, the cheapest plan, get all your subsidies, and then literally you get your supplemental products. You pay $100 a month total because most people qualify for almost zero premium products. You get your, so you go from paying $700 on the company plan to $100, and you have better benefits on your own.
Yeah.
Now, if you're a company, you're saying, wait a minute, I want to give my employees better benefits. We'll give them a $40 benefit bank, let them choose what they want. If they want to buy dental, vision, whatever. And what we're going to do is we're going to give them a benefit that is better than they've ever had. We're going to give a zero deductible plan. Everything's a copay, make it simple. And literally what you would see is you'd see everyone paying, employers included, half of what they're paying right now on a bad day. On a good day, 90 to 100% because of the fact you have employees who qualify for subsidies. Why are you preventing them from taking them? It's their tax breaks. Do you prevent them from taking their dependents as tax breaks? No. So why are you doing it with your health insurance? What's going on? People got to wake up.
All right. So let's talk about, those particulars, Tom, in today's podcast. And this is affordable health insurance solutions for remote and hybrid teams. A
Okay.
lot of times, Tom, companies don't think they can afford insurance for their employees and not understanding, or employees and not understanding they can't, right? Especially you're not at that guideline you have to.
Everyone's in a state. They reside in the US. They can literally get an individual plan if they'd like. The company can reimburse it tax-free and can agree to pick up part, if not all, of their deductible tax-free because of a 1954 law called Section 105. And what they're creating is a medical expense reimbursement plan, and they don't have to worry about all the silly rules these group health insurance plans have. Like so many people have to be at this location. You have to have X amount of participation. You got to contribute X, Y, Z. Eliminates that all in one swoop. So if they want, they can buy a national plan, PPO plan, and give the employees a choice. If they want to buy that, be on that plan, great. If not, let them get on their own plan. You can still cover everyone with benefits.
Well, and here's my question for you, Tom. Why is it difficult that companies that are hybrid or remote, it's harder for them to insure people? They think. What do you think the reason is?
Uh, the old adage, don't let the truth get in the way of a good story unless your money or your rear end is on the line. So the agents aren't thinking, all they think about is group health, And all the HR directors think about is we want Blue Cross, Blue Cross. They don't understand that you're running a network. The benefit piece is what you can control, which keeps your employees happy. That's the big reason they're getting advice from people who, it. Let me throw this out at you. Would you rather have, I don't know, Otani? If you had to win a baseball game, would you want Otani at bat, or would you want a third grade T-ball player at bat? And the answer's
Otani, not a third grade. No.
right. Well, that's what they're doing with their health benefits. That's about the difference from using us and using their agents. And I'm not trying to be rude, but the agents are getting paid commissions based on how much they can get you suckered into paying more and more. We're getting paid on what we save you. Big difference.
There's a total difference, for sure. And the modern workforce. So I guess what you're saying is a lot of times if you have a company that's remote or hybrid, you really don't even think about health benefits because of certain reasons. And it's because they don't think that if they can't get the Cadillac group health plan, that company, some of them just forego it altogether.
Well, they forego it, but what they're doing, the other thing they're losing tax breaks too, because benefits is they get a better tax break than payroll. They get to write 100% of that off, and it lowers their payroll also if they have the employees paying, right? So they get to take advantage of a lot of things. But the problem is the employees and employers out there they haven't done any research. We were screwing around with AI before this, and it was kind of funny asking certain questions. Go on and do AI and not right now, but the employees and the employer and ask them what a medical expense reimbursement plan is.
I don't think they're going to know it. Not many people, right?
Well, you can Google it too. If you don't want to do AI, just go to Google.
And you'll
And
find it, but AI will be able to answer it correct, but the other
but
person might not.
my
Yeah.
problem is the problem I see is there is no issues where you are. If you want to be in Montana, be in Montana. If you want to be in North Dakota, be there. If you want to be like me in Florida and get a sunburn, go for it. Do whatever you got to do, right? But every state has the Blue Cross plans for the most part, and a lot of them are the same networks that you would buy on group, PPOs,
Oh,
HMOs, point of services, all these buzzwords. And all we're doing is taking advantage of the way the game should be played.
right. And what you see, Tom, is that they basically think because they're in all these different states that they can't cover it and what happens? Do some of the companies just never cover healthcare and just take the hit? Because there is a hit if you don't cover employees,
Only
right?
for employers with 50 or more employees, and it's called the employer mandate penalty. And if their salaries are high enough, they don't qualify for subsidies, so there is no hit. But if they're not, and one person gets a subsidy, then you get your first 30 employees free, and then you got to pay a excise tax or employer, whatever they call mandate penalty, and it's roughly 2,500 a year per employee, um, above 30. And then they have full-time equivalents and they have formulas and how to get to the 50. But the funniest part of the whole thing is if people got the calculators out, most companies would be better off paying the employer mandate penalty than putting in the group health plan and letting their employees get subsidies and then setting up a MERP to make them have better benefits. Because the true cost, like take a group of 70, it's like 190 a month because you get the first 30 free. So you're paying a penalty on 40 people. Well, go get a quote for 70 on a group health plan the way that the agents are selling it. You will go, we're saving like $400,000 a year by paying the government the penalty.
No.
Yeah,
Okay.
yeah,
But this is what you do in your team at ClaimLinks too. Help companies get better health insurance for their customers. Less money for them. Say the company saves money and everyone's happy because retaining good employees, what do you need to give them?
You need to give them decent salaries, a good workplace, and benefits are key because a lot of these folks have these plans with a $5,000 deductible. And if you think about it, if you use it, you're spending $2.41 every hour you work for that employer just to pay for your deductible on yourself. Imagine if another dependent did. Now it's 482. And then they're asking them to pay 400 or 500 a month for their family. Now, at least that's pre-tax. So usually now you're at, if you use it, 7, 6, 7, $8 an hour, and it's supposed to be a benefit. Doesn't, you know, doesn't sound very good to me, but hey, that's what they're all doing because that's what they've been told by these agents who take them to the ballpark in their suites. And I sit there and I go, if you did the math, you'd figure out not only do you increase the value based on what we call EBITDA, but you can buy your own suite at the ballpark and not have to deal with people who are trying to sell you stuff.
Mm.
You can bring your customers there.
This makes complete sense and so many sense of the word. And this is where we're going to have the interesting process of what to talk about because you do such great things. But we're going to have many more guests on this podcast. We're going to tell people, but what I have learned, and this is me speaking out, this
Mhm.
works. This absolutely works. It's worked for me. It's worked for one of my clients. I already introduced Tom to, and it's going to be a continual people that need to save on their health benefits, even individuals or insurance group insurance people, meaning the employees. They can save money on their health insurance, better benefits, better situation, happy people, they stay. They are able to take care of things. And Tom, you have that secret sauce to help people, right?
I have a sauce that if you mix it correctly, everyone will think it's sweet and it's good.
All right. So the best place to go is claimlinks.com. Appreciate it. We'll talk soon. That was the special simulcast Neil Haley show and also the Cutting Edge Benefits podcast, guys. Take care.